I'd like to start off by welcoming Dr. Serena Chumsri, who is going to continue for us today with an explanation of metastatic breast cancer and explaining the disease. She's a graduate of the top medical school, Chulalongkorn University in Bangkok, Thailand. She trained in internal medicine at the Albert Einstein Medical Center, as well as hematology and oncology at the University of Maryland. With over 40 publications, Dr. Chumsri is an expert in breast cancer research.
Thank you. I would like to thank the organizers for inviting me to discuss with you today about breast cancer. So we'll start a little bit about what is breast cancer. I'm going to make it formal, and if you have any question, you can ask the question later on. So breast cancer is actually the disease that originating in the breast. Most of the cancer originate in the ducts that lining the breast or the lobules that make up the milk. And when the cancer grow inside the breast, it can spread to it usually commonly go to the regional lymph node, which is the lymph node in the axilla area, and then some of the lymph node around it. And then after that, it can also travel to distant site in the body, things like lung or liver or bone. And once the cancer has spread outside beyond the regional lymph node, which is more like the main gate of the main gate that contain the cancer, once it spread beyond that, whether it's one spot or two spots or three spots in the body, it's considered as metastatic breast cancer. There are a term now called oligometastatic breast cancer, because sometimes we do have some patient that only had one or two little spots of cancer that metastasize to other organ, and some of those patients may do very well for a long period of time. But currently, as for the staging that we use to stage the patient, is considered as metastatic cancer. So any breast cancer that has spread beyond the regional lymph node is considered as stage 4. Most commonly, even with our current treatment modalities in 2017, we still consider metastatic breast cancer as incurable disease, because once it's spread beyond the lymph node and we're not able to contain it, it's become incurable, and most of the patients had to remain on treatment lifelong. Breast cancer is actually a true global disease problem. As you know, it's one of the most common common cancer among women worldwide. And it was estimated 1 out of 8 women that you see around you will develop breast cancer at some point in their lifetime. In the US alone, there are about 230 new cases of breast cancer alone. And even though we come a long way with treating breast cancer, we are very effective in treating and curing breast cancer. Breast cancer, when it metastasizes, is still incurable. It's still a lethal disease that kills women. So there are about 40,000 cases of women that die each year because of breast cancer. Breast cancer is also not a disease just women that will get breast cancer. Men also get breast cancer, but at much lower incidence. There are about 2,000 cases of men who develop breast cancer, and about 400 cases of men who die with breast cancer each year in the U.S. In the state of Florida alone, there are about 14,000 cases of breast cancer. Breast cancer is a disease of aging that we see across all age, but the incidence rises with age. And when you see look at the older population, especially patients older than 50s or so, the incidence rise abruptly. The median age for breast cancer right now is about 61 years old. The diagnosis of breast cancer can be very difficult and very challenging, and we will hear from other speakers that talk later today about some other social aspects and other things about these women that live with breast cancer. It's very difficult to cope with the diagnosis, and we do have some of the young lady that develop breast cancer. These are young women that has little children and growing family, and it's very difficult for their family. to cope with the diagnosis, and some of these women still has to work, and it's very difficult for them to come out and talk about their diagnosis and manage their family. And that's a big challenge that we see every single day in treating metastatic breast cancer. But we come a long way with treating metastatic breast cancer. There are many treatments available right now for patients with metastatic breast cancer. Even though it's incurable, it's treatable. We can treat and control the cancer. But the problem with the treatment is that this treatment unfortunately doesn't work forever. It will work at certain point of time, and later on cancer cells are just so smart, they mutate and change and become resistant to the therapy. So that's why we always have to constantly monitoring the disease. Patients often need to have a follow-up scan and then see how long the treatment will work. And later on, once the treatment has stopped working, we have to change the treatment. We have several lines of therapy that's available for breast cancer patients. And when we treat these cancer, we normally go by their molecular profile inside the tumor. So if you look at the gene expression profile across all breast cancer, all breast cancer is actually not created equally. In a simplistic way, you can divide it, breast cancer into 4 categories, roughly. The 2 being the hormone receptor positive breast cancer, things like luminal A or luminal B breast cancer. So these cancers are usually respond really well to hormone blockers, which is a pill that most patients can take at home. Things called aromatase inhibitor or tamoxifen. We now have the new drug that can also target the cell cycle called palbociclib that can actually help and make these hormone blocker works really well, and patients actually can do well on just the hormone blocker, which is the pill, and palbociclib, which is also a pill for a long period of time. The other type of breast cancer called HER2 positive breast cancer. This type of breast cancer used to be one of the worst breast cancer to have. It's very aggressive form of breast cancer. But now with the new research and invent of the new medical treatments and things, we do have multiple treatments that can target this particular protein. Things like trastuzumab or trastuzumab intensin or pertuzumab. These are just lists of drugs that can target specific HER2 protein inside the cancer cells, and that actually has revolutionized how we treat these patients with metastatic breast cancer. And these patients can do very well for a long period of time without need, some of them may not even need chemotherapy and just need the targeted therapy to target that certain specific pathway inside of the cancer. The last type of breast cancer is actually more difficult. These are the cancer that lack all 3 receptors that we can use to target the breast cancer, things like estrogen receptor, progesterone receptor, and HER2. And by not having all of these receptors, the treatment that we commonly use to target these cancer, like the hormone blocker or the anti-HER2 therapy, unfortunately do not work for these patients. Even with our advancement in breast cancer treatment, this type of breast cancer pose very challenging situation. It's still very difficult to treat, and the only treatment that's available right now for these patients are actually chemotherapy. This type of breast cancer is actually more commonly found in younger women, usually less than age 40, and also more commonly seen in minorities like African American patients, Hispanic patients tend to develop triple negative breast cancer at much more common. So if you look at some of the database from the Carolina group or some other database in young African American patients, up to 56% of these young patients can actually develop triple negative breast cancer, and it's very difficult situation. But we come a long way. We do have many treatments and research that ongoing in triple negative field. I just want to highlight about the things called immunotherapy that now coming out and been approved in multiple type of cancers, because immunotherapy works by improving patients' immune system to target and attack the cancer, and it not really target the cancer itself, it's target the host immune system. So this type of treatment has been approved in multiple forms of cancer. like lung cancer, melanoma, lymphoma, bladder cancer, kidney cancer. And in breast cancer, we just started to see some of these drugs that has some of the effects in breast cancer, particularly triple-negative breast cancer. So there's a lot of hope in this kind of therapy. But the response to the treatment is not universal. So if you look at the studies in triple-negative breast cancer, the response rate is only about 30% or so. And there's still a lot of room to grow to try to make these tumors more immunogenic and help make the patient's immune system be able to attack them more. So I think with that, I'll end my talk, and then we'll have some more questions later on. Thank you.
All right, thank you, Dr. Chumsri. I think that's a very good introduction, and it sort of helps us understand overall that, metastatic breast cancer is just not metastatic breast cancer. In the big picture, there's lots of different subtypes of metastatic breast cancer that can either make it a little bit easier to treat or more difficult to treat.